Everybody in this room knows that this is a transformational moment in healthcare. The ability to collect massive amounts of data is revolutionizing how we think about patients and their care, and potentially giving physicians new ways to provide more precise, safe, and customized attention. So this morning we're going to be hearing from people who are at the forefront of this development, from patient advocates to experts in this data arena, both public and private, and it promises to be an interesting and important conversation. I have a few notes before we get started. We are on Twitter at Atlantic_Live. You can join the conversation using the hashtag FuturePatient. We are streaming live at Atlantic.com, and we will be taking questions after each session. Don't forget to silence your cell phones. And I want to thank our underwriter, GSK, for making this morning possible. Thank you. And now I'm delighted to introduce GSK's Vice President of U.S. Policy, Tanisha Carino, here to say a few words. Tanisha, the floor is yours.
Good morning. Okay, so how many of you out here have a Fitbit, a Misfit, or a Jawbone? All right, that's great. So if you do, you're collecting and storing your own personal health data. And if you're anything like me, that data nags at you, and those numbers nag at you all day to get up and walk around and realize that sitting is the new evil. And that's just the impact of small data. Big data in healthcare includes the promise of using all of our health information, our genetics, our behaviors, our predispositions, and our likes and dislikes to tailor our care and lead to innovation. Information, as you all know, is the foundation for transforming healthcare, and the digital patient is at the center of that transformation. Data and information are also the keys to improving healthcare quality and safety, reducing overall costs, and empowering patients and their caregivers to be engaged in their own care. I want us to consider Secretary Burwell's goal of tying 85% of all traditional Medicare payments to quality and value by 2016 and 90% by 2018. This is the first time in the history of the Medicare program that HHS has set out an explicit goal for moving us towards a value-based healthcare system, and it is an exciting and audacious goal. At the root of these changes is the ability for providers to access data, gain insights, and apply this knowledge at the point of care. And combined with new payment forms, the availability and exchange of information is needed to achieve the promise of population health. Data is a means to an end, and that end is better health outcomes. So in this move to value in population, where does patients come into the picture? What's their role in defining value and quality? What's their incentive to become engaged in their care and to digitally connect? And what is all of our incentive to share data and to contribute to this digital world? These are just a few of the questions that our panel and the discussion after with CMS's Niall Brennan will touch on today. And today is all about the patients, and I'm excited to learn more about the work that we do with data so that we can all improve the healthcare system. For those of you who don't know, GSK is a science-led healthcare company. We discover and develop medicines, vaccines, and consumer health products that help millions of people around the world do more, feel better, and live longer. This year, GSK ranked number 6 in Fortune's list of companies changing the world. And since 2009, we've had more medicines approved in the U.S. than any other healthcare company, including treatments for asthma, COPD, HIV, and cancer. And we're the world's largest manufacturer of vaccines, with the world's first malaria vaccine recently approved. This laser focus on a healthier world has led us to dig deeper for ourselves in how we use data to improve population health. And as an example of that, our collaboration with the Community Care of North Carolina has resulted in the development of Care Triage, a medication management predictive analytics model that uses patient-specific data to identify those at risk for poor health outcomes. Care Triage has been proven to predict patients at risk for hospitalization due to drug therapy problems and supports the decision-making of providers, patients, and their caregivers all across the healthcare system. Our learnings have shown us that our patients with chronic disease see their primary care physicians twice a year, yet these same patients see their community pharmacies at least 30 times each year. Because population health should engage patients where they are, Our learnings led to building a community pharmacy enhanced services network and a federal grant award of $15 million to CCNC to study the role of community pharmacy in a broader medical neighborhood. We look forward to the University of North Carolina's Eshelman School of Pharmacy, who is evaluating this program and will be sharing best practices that can be adopted by other systems. So the takeaway message for us today as we transition to our panel is that healthcare is undergoing major transformation. Access to data, applying it to improve care, and empowering patients is a critical component to the move towards value. And we can't just flip the switch. Each of us has to take it upon ourselves to collaborate with each other to figure out the best way forward. It's a journey, and I look forward to hearing more from our panelists on their own personal journey to improve patient care. Thank you.